is Duane Haines. I am emeritus professor at the University of Mississippi Medical Center in the Department of Neurobiology and Anatomical Sciences. The name just got changed. I also have had extensive teaching in residence of neurosurgery and neurology for their specialty board exams. My textbook with Elsevier is entitled Fundamental Neuroscience for Basic and Clinical Applications, and it's a book designed for teaching the first year, predominantly the first year medical student. All the other student groups use it. It really was designed to have a good anatomical base, because nowadays in MRI and CT you see all this anatomy in these images in great detail, and to introduce applicable clinical information in the proper context, so the student will know when they're studying a particular track that this is why clinically it's important to know about. Clinical information without an understanding of what is going on is only half there. In other words, if your patient has a paralysis on one side of the body but you don't know why, then you're not a very good physician. And this book is used predominantly by students who are learning to become physicians. So we kept that in mind. Good anatomy, because that's the basis of understanding why the patient has this neurological complication, and then good clinical correlation to illustrate why the patient is behaving the way they are. The book has changed by, one, constantly improving things. For example, you get better examples of CT and MRI. You get more precise examples. You get more unusual examples. In this upcoming edition, we're putting in 3 MRI that show very tiny lesions in the midbrain that give rise to very specific sensory deficits. And these are 3 actual cases. They're not made up or anything like that, so it's exactly what the patient showed. So we've improved the artwork. We've done new artwork. We have added things. We've taken out some things that we probably didn't need to have in to keep the book reasonable length. So the improvement has been based on my being exposed to residents over this time, talking to medical students to find out what worked and what didn't work, and being sensitive to that. I think you need to remember several things. First, when you're going through the basic science courses in the first year, you are competing for your residency. Secondly, I think, is to put yourself in the place of your future patients. If you think you're working too hard, think about what kind of person you want, what kind of medical student do you want to be if you're going to be the physician for a 22-year-old woman whose 6-week-old baby just died and she is hysterical. What kind of physician would you want to be if that was your wife? So I think there's a thing about we need to work hard as faculty and put ourselves out, but the medical student also needs to work hard and put themselves out. And it's success for both. The new edition of our textbook will be the 4th edition, and we're doing a number of things a little differently. One, we have replaced or significantly modified probably 50 to 60, or added new 50 to 60 pieces of artwork. And all of that's designed to make the content and the usage more clear. We put in lots of new MRIs. We have much more clinical information in the limbic system chapter. A second thing that's going to be really different, I think really helpful to the students, is all clinical information throughout the book is going to be highlighted in light blue. So when the student opens the book just to a set of pages, everything in blue is clinical. And in some chapters that's a significant amount of information, because I've always believed that we're trying to teach the medical student to understand how valuable this clinical information is and how directly it relates to the anatomical